purpose of this video will be to introduce electronic health records, or EHRs. I will begin by explaining exactly what EHRs are. Basically, an electronic health record, or an EHR, is a computerized version of a patient's paper chart. EHRs are real-time patient-centered records. They make information available instantly, whenever and wherever it is needed, and they bring together in one place everything about a patient's health. EHRs can contain information about a patient's medical history, diagnoses, medications, immunization dates, allergies, radiology images, and lab and test results. They offer access to evidence-based tools that providers can use in making decisions about a patient's care. They automate and streamline providers' workflows. EHRs are also increase organization and accuracy of patient information. They support key market changes in payer requirements and consumer expectations. One of the key features of an EHR is that it can be created, managed, and consulted by authorized providers and staff across more than one healthcare organization. A single EHR can bring together information from current and past doctors, emergency facilities, school and workplace clinics, pharmacies, laboratories, and medical imaging facilities. Next, we're going to talk about different components of EHRs that support direct clinical care and talk about the benefits and issues. The transition from paper records to electronic health records represents a fundamental change in the way a physician office operates and interacts with patients. Everyone who works in the office, whether in a clinical or administrative position, in the front office or the back office, will have to learn a new way of doing things. All tasks related to providing health care to patients will be entered, stored, and maintained in a computer-based EHR. And consider how a few common tasks are different in an office that has fully implemented an EHR. There's no need to pull a patient's chart the day before an appointment. All the information that was stored on the paper chart is in the computer and can be accessed instantly. There is no need to print a super bill for a patient's visit on the day of the appointment. The provider will document the office visit in the computer, which will generate preliminary codes based on the electronic documentation, chronic diseases, clinical guidelines, computer-assisted coding, decision support tools. There is also no need to handwrite a patient's vital signs on paper. Vital signs will be automatically entered in the computer by digital medical devices. There is no need to manually enter procedures and diagnoses from a super bill into the office billing system. Procedure and diagnosis codes are generated during the office visit, will be reviewed and finalized by a coding specialist, and will automatically become part of the billing module of the EHR. There is no need to handwrite most prescriptions. Prescriptions will be entered in the computer and electronically transmitted to a pharmacy, with a few exceptions. There is no need to wait for a patient's test results to arrive via fax machine or in the mail. Laboratory and radiology results are transmitted electronically to the physician and become part of the patient's electronic health record. Some of the basic benefits associated with EHRs include being able to easily access computerized records and the elimination of poor penmanship, which has historically plagued the medical chart. EHR systems can include many potential capabilities, but three particular functionalities hold great promise in improving the quality of care and reducing the cost of the healthcare system level. Clinical decision support tools, or CDS tools, computerized physician order entry systems, or CPOE systems, and health information exchange, HIE. These and other EHR capabilities are requirements of the meaningful use criteria set forth in the High-Tech Act of 2009. A CDS system is one that assists the providers making decisions with regard to patient care. Some functionalities of the CDS system include provide the latest information about a drug, cross-referencing a patient allergy to a medication, and alerts for drug interactions and other potential patient issues that are flagged by the computer. With the continuous growth of medical knowledge, each of these functionalities provides a means for care to be delivered in a much safer and more efficient manner. As more and more CDS systems are used, one can expect certain medical errors to be averted, and that overall the patient will receive more efficient and safe care. CPOE systems allow providers to enter orders such as drug-related errors and poor penmanship of physicians. It also makes the ordering process more efficient because nursing and pharmacy staffs do not seek clarification or to solicit missing information from illegal or incomplete orders. Many clinical outcomes that have been focused of EHR studies relate to quality of care and patient safety. Quality of care has been defined as doing the right thing at the right time in the right way to the right person and having the best possible result. And patient safety has been defined as avoiding injuries to patients from the care that is intended to help them. Quality of care includes 6 dimensions, but most EHR research has focused on the following 3: patient safety, effectiveness, and efficiency. Organizational and society outcomes studies have focused on EHR use in both the inpatient and outpatient settings. Such outcomes have frequently included increased revenue, averting costs, and other benefits that are less tangible, such as improved legal and regulatory compliance, improved ability to conduct research, and increased job career satisfaction among physicians. Increased revenue comes from multiple sources, including improved charge, capture decrease in billing errors, improved cash flow, and enhanced revenue. With an EHR system, many billing areas are inaccurate. Coding may be eliminated, which would potentially increase providers' cash flow. Many averted costs associated with EHRs are the result of efficiencies created by having patient information electronically available. There are also different components of EHRs that support the administrative process. In an office with an EHR, all test orders, prescriptions, and educational materials are waiting for the patient at the checkout desk. The front desk staff member reviews the billing screen on the EHR to see if any additional payment is due and schedules any follow-up appointment before the patient leaves. With an EHR, codes are then checked for accuracy by the coding specialist and included in the electronic claim. The billing staff members create electronic claims and transmits them to payers for reimbursement. Payers want to know whether the service provided was appropriate for the patient's condition and whether the treatment was necessary. These diagnoses and services are transmitted along with the electronic health record, and the codes assigned to the diagnosis service plays a major role with whether the physician is paid on time. It's important to document code as accurate as possible, and in an office that does not use software in the coding process, codes are assigned by a member of the coding staff. And with an electronic health record, the codes are assigned according to the processes that were completed according to the electronic health record. Clinical tools in the EHR are much more than a computerized form of paper medical record. In addition to streamlining the workflow of the physician office, the EHR contains features that aid clinicians in providing patients with safe, effective health care. Some of the more common features are accessed during clinical information while making the diagnosis, identifying patients at risk for specific diseases, and monitoring patients' compliance with prevention guidelines and recommended treatments. To provide effective treatment, the provider needs up-to-date information. At the same time, the information is constantly changing. It's also constantly expanding. Researchers are working to develop new treatments, and the availability of inexpensive computing facilities makes it easy to collect and process large amounts of data. Today's physicians are faced with an overload of clinical information. An EHR can give assistance with the decision support tools, deciding on the best treatment for the patient, requiring not just information about the patient's current and past condition, but also access to the latest medical knowledge. Decision support tools are features of many EHRs, make the latest clinical information available to providers at the point of care. With these tools, there is no replacement for the judgment of experienced physicians, but their use may lower the number of medical errors and result in better patient outcomes. Thank you.